CLL patients generally have an elevated lymphocyte count. Most of them, the disease circulates in the blood. And typically when we treat them, we expect that what will happen is that the treatments will reduce that lymphocyte count in the blood as well as reduce their lymph nodes. But what's been observed with these small molecule kinase inhibitors, actually dating back a number of years ago, first with everolimus, an mTOR inhibitor, as well as with fostamatinib, a SYK inhibitor, is that the patients have good lymph node response, they improve symptomatically, they feel better, but at the same time their lymphocyte count starts going up. And in the traditional criteria, that was associated with progressive disease. But in the case of these patients, it was clearly not progressive disease because they were having improvement in symptoms, improvement in lymph nodes. And then what was noticed over time was that the white count would go up to a certain point and level off and just sit there and then start to come down in some of the patients. So what we as investigators realized was that it appeared what was happening was that cells were coming out of lymph nodes and bone marrow into the blood, sort of redistributing, and that was actually associated with response to the drug in many patients. It's not a clinical problem. It doesn't bother the patients. But in the traditional response criteria, it prevents us from calling patients as a response. Now, those response criteria have recently been revised in a number of different letters and discussions and publications to indicate that if the lymphocyte count goes up on one of these drugs, that's not progressive disease, and that in fact patients whose nodes go down by at least 50% in the presence of a lymphocyte count that's still high can be considered to have a nodal partial response with lymphocytosis. So you don't really have to get rid of it, but if you are trying to get people into complete remission or minimal residual disease negative complete remission, you can perhaps accelerate the clearance by giving additional agents that will clear blood, like antibodies, like chemotherapy.